Hi, everyone. How are you? I'm Tara. I am the lead Nexus provider for Telemedica. And I want to thank you all for joining us for our weekly sessions here in June, where we're talking about medical support evidence. Now, I'll give a few minutes for people to filter in. And so, do a quick recap. Last week, we started off this series talking about DBQs. This is a new service that Telemedica has re-added, or I shouldn't say new service. We have added them back into the mix. And our service list. And so, if you are in need of a DBQ, we definitely can help support your claim with that. There are several that we are able to do virtually. Um, if you're not sure what a DBQ is or want to learn a little bit more, check out our video from last week on the replay. It should have a lot of helpful information, or don't hesitate to reach out to us to ask a few questions. Now, this week, we're going to be talking about Nexus Letters. So I'm going to go through a little bit of detail about Nexus Letters, go through a few questions as far as most common questions that I get about Nexus Letters that will help people get on the same page about this type of a document and may help you understand if this is the right path for you or something that could help benefit your service connection claims. So I'm going to dive right into it with the first question: what is a Nexus letter? So most of you may already know what that is. However, there are definitely a lot of people that I come across who are new to this process or who just aren't really sure exactly what it is. They've heard the term, but they really don't know exactly a good definition for what it is. So a Nexus letter is a supporting document that veterans use for their VA disability claims to support that the claim that a condition is connected to service directly, or that it is connected to service secondarily through another service-connected condition. Those are typically primary claims versus secondary claims. So primary claims would be those that have records in service of an in-service event or are under a presumptive condition or presumptive list. There are several presumptive types of service connection with the military, with the VA, that can be applicable, and all of the information is posted by the VA. Most of them are exposures. So the best way that I'd say to navigate it would be to Google search for VA disability exposures, because I found that you usually get a VA website faster that way, because when you look through Google, what comes up at first are a lot of advertisements, and a lot of them are private companies, law firms, other informational sites. But what you're really looking for, if you need to know the definition of some of these presumptives, is you need the VA site. And it can be difficult to navigate through if you just go to va.gov. So I've found most success by Google searching or directing people to Google search for the VA disability exposures, because that should take you to the main the main page that will have all the different breakdowns of the presumptive conditions, and you can kind of easily navigate from there. So Nexus letters in relation to presumptive conditions. Since I started on talking about that, I want to answer that question first. So presumptive conditions are those conditions that are already accepted and proven to be connected to service. So why would you need a Nexus letter for that? Well, they may have specific details that you don't fit that criteria. So there are specific criteria for each different type of presumptive condition. And if you may have 3/4 of the qualifying criteria, but you're missing something, it doesn't qualify as a presumptive. It would qualify as a case-by-case evaluation to see if it could be linked as a presumptive condition. So Nexus letters can help with those types of claims. The most recent and best example I can give for this are the particulate matter exposures with rhinitis, sinusitis, and asthma, because those presumptive conditions came with a 10-year diagnosis requirement. So what the VA and the government has decided is that, yes, particulate matter, you were exposed. If you were overseas, burn pits, all of that, you had this poor air quality and exposure. And there are respiratory conditions, chronic rhinitis, chronic sinusitis, and chronic asthma that are associated with it. However, that stipulation of being diagnosed within 10 years from leaving that area, leaving that deployment site, is one that I find a lot of veterans are falling short on. And so therefore they don't qualify for presumptive. If you did qualify for presumptive, you don't need me. You don't need anybody else. You just need to submit the qualifying documentation that you met the criteria and you're good to go. The VA will approve it. No questions asked, done deal. It's that easy. However, a lot of people don't have those qualifying factors. And when that's where you come to see a private company or you ask your doctor for a Nexus letter to help show that you meet the criteria despite that one specific thing. So, speaking to rhinitis, sinusitis, and asthma, most people don't go to their doctor for every sniffle that they have. And so it is very common for people to try to self-treat or to use over-the-counter medications or tough it out for a long period of time. And that 10-year requirement, I find a lot of veterans are getting hung up on. And what we usually do to help support that document is use whatever evidence we can find and prompt you to provide to us to show that that condition started within that 10-year time period. And then the medical opinion of a Nexus letter gives it that extra solidification of saying, okay, all of this data has been evaluated by a medical professional. And their medical opinion does carry some weight into that circumstance. So Nexus letters can be very helpful. I'm sorry, I definitely came off topic from where I initially wanted to have this conversation, but I felt like it was more appropriate since I brought up presumptive conditions right off the gate. So the second common question I get, what are the components of a Nexus letter? And so I can only speak to Nexus letters that me and my team write at Telemedica. There are a lot of different options. There isn't any fast and hard rules when it comes to this, but we believe that our formula for writing Nexus letters is superior simply because it's not just our opinion saying, hey, I'm Tara, I'm a PA, I went through training, I got a degree, so did hundreds of thousands of other people, and here's my opinion. And it's based on, just what I believe. I feel that that's not sufficient enough. I feel like that definitely gives us the ability our credentials give us the ability to make that opinion, to hold weight with the VA when considering our letters, but I think we need more support, and that's why our documents carry more additional support for that. So for Telemedica, we like to ensure that your current condition at its current state is documented, including any limitations that prevent you from functioning at home and work. That is important in many of the service connections. The reason it's important is because the rating criteria, as I talked before about the 38 CFR, which is the Code of Federal Regulations where rating criteria can be found, it's all published. A lot of it lies on the current status and or how it impacts your ability to function and work. And so that can make the difference between a rating percentage of 0% or a rating percentage of 30, 40, 50, 60%. It's huge. So not only is a Nexus letter helpful to connect the condition, but it can actually support also the higher ratings because we're documenting that you meet those criteria of a higher rating by being able to say this is the current status, not only reported by you, but also by the evidence that we're finding in the records we're reviewing. So it can be very helpful for that. We then go and support our medical opinion with peer-reviewed journals or subject matter expert data. This is important to show that our opinions are based in fact, that is replicated, that is documented by experts in their field with the peer-reviewed journals, and that's tested, that this is not something we pulled out of nowhere out of thin air saying that, for instance, sleep apnea is connected to PTSD. It's aggravated by PTSD. We don't just pull that out of the air. We actually pull that from data. They're testing that information. And it may not be something that's widely accepted in the medical profession for practicing medical professionals, but it is definitely accepted in the research side of things. And what we find is that research breakthroughs usually happen a lot faster and than what's widely accepted in practice. That practicing medicine, it is delayed. The research needs to be proven and replicated and then proven again and shown again before practicing doctors implement any changes in your treatment. So you got to think that these practicing doctors are thinking about your safety and how to treat and cure your condition. Whereas the research side of medicine is based on trying to figure out how things work, how are they connected, so that we may be able to push it to the next step and develop treatments for these conditions. So it's sort of, it's that's where the delay comes from. In my opinion, I think that a lot of people who are practicing medicine care mostly about the research, about new drugs that are coming on the market, new treatments that are coming on the market. But to get to that stage, you need to do the initial research first. And that's where there's a delay and a gap in the medical profession, in my opinion. So we like to look at the full spectrum of research and how it connects to a condition. And we like to add that data into your Nexus letters so that our opinions are supported in fact, and not just coming from someone asking me, could that be possible? And so our medical license is not where we don't hang everything on that. We like to support it in evidence-based medicine as well. We also include any precedent cases that can support your claim. Precedent cases, if you don't know what those are, they are cases that have been determined that can be applicable to everybody, to all veterans in every situation. So you may have heard of VA Board of Appeals cases, and sometimes they can be used and have been used in the past with support of veteran cases or veteran claims, but they're not precedent because they are specific to that veteran. So the VA considers each veteran as their own individual, and their circumstances can be different and not applicable to everybody. And so that's why VA Board of Appeals cases are not held with a lot of weight, because you're not comparing apples to apples. Whereas precedent cases are those that are. Now, some of those that we use, I know that we talk a lot about weight gain as an intermediate step between connecting two conditions. That is a precedent case. That is something that has been evaluated and determined that can cause your service-connected condition, can cause another condition through weight gain, as long as the weight gain is caused by or primarily caused by that service-connected condition. So there are a lot of those cases that we use in support of your claim. And that's not something that someone who's not a professional in this field is really privy to unless they study and are familiar with VA regulation. So the other thing we like to use is the VA language. So there are specific phrases and terms that the VA uses. We like to use their language in our letters simply because it communicates things properly, similar to communicating in a medical document. You know, if I'm reading, for instance, an imaging study, a CT report from a radiologist, they're using the medical language to communicate things to the medical provider. Now, me reading that as a medical provider, I look for the language, medical language, in order to accurately communicate things. And that could be position of a joint, location of a condition. It could be the severity of a condition. And so it's a way to quickly and accurately describe something. And that's how we like to include that in our Nexus letters. We like to make sure that we use the VA language so that the raters and or CMP examiners are getting that communication from us in language that they understand. The raters should be very, and CMP examiners should also be well versed in the VA language, and in communicating in those terms should eliminate any simple errors that may be caused by using terms that are unfamiliar to them. So the next most common question I get is a Nexus letter required? No, a Nexus letter is not a requirement, but many veterans find them helpful in increasing their chances of success, whether that's successful service connection, faster service connection, higher rating percentages. So many veterans will find that using a Nexus letter can be helpful for those reasons. So who can write and fill out a Nexus letter? Your treating provider, private companies such as Telemedica, and other specialists depending on the connection. So private companies like Telemedica, we specialize in these type of documents. This is all that we do. I know I get asked a lot, can I get a document for Social Security? No, your treating provider should be doing that. We specialize in Nexus letters. We specialize in DBQs. We specialize in VA disability documentation because we are well versed in the regulations. They are updated frequently, sometimes multiple times a month, and we are well versed in that language and keeping up with those updates so that we have the most up-to-date knowledge, up-to-date experience, and are on the exact same page as what the VA raters and CP examiners are on in order to provide you accurate documentation. So, for instance, I want to talk about medical providers who should not be completing Nexus letters. So, for instance, a medical provider such as myself, NP, MDDO, someone who is medically licensed, should not be filling out a Nexus letter for a mental health condition. Psychologists, psychiatrists, they are specialized in those types of diagnoses. Even though I do in an ER, because I'm specialized mostly in emergency medicine, I do see mental health patients clinically. I can treat them. I can take care of them. However, writing a Nexus letter is very different from that. I don't have the medical expertise in mental health, which means when we treat mental health patients, we often do that in conjunction with a mental health professional. We take care of their emergency needs, take care of their medical needs, and defer chronic treatment, whether that's medication, therapy, combination of both, or any other sources of treatment, to the mental health professionals. That's what we do clinically. So there's no reason that a medical person should be writing your mental health Nexus letter, because they are also not the subject matter expert. There are fine-tuned details between different conditions, and psychologists and psychiatrists train for many years, not just in school, but also clinically, in order to understand those conditions on a very deep level. This is why we defer all of those conditions to the mental health team at Telemedica. They are absolutely the subject matter experts and should be doing those documents. I know someone might disagree with my opinion on that, but I feel very strongly that you shouldn't go to a medical doctor if you need surgery. You go to a surgeon. It's the same thing. You go to the specialist that is experienced in treating that condition. So what about other professionals such as physical therapists? Are a big one that I get a lot of questions about. Well, the key to knowing if someone's qualified is if they're licensed to diagnose and treat that condition, or are they a subject matter expert? That is the key. So talking about the example with a physical therapist, a Nexus letter would not be helpful from a physical therapist for your sleep apnea condition because they are not licensed to diagnose and they are not trained to treat that condition. A letter from them could be helpful in an orthopedic situation, but it would not be the same type of a Nexus letter that an MDDO, PA, or NP would provide, because they can only comment on where they're subject matter experts in. So they can only comment on things such as range of motion, strength, and your lack of progression or your positive progression in a physical therapy setting. That's the only thing they're really a subject matter expert at. So commenting on something like a medical condition, even an orthopedic condition, you have to understand what you're asking of them. So, and what that document is going to do for your case. So for instance, for an orthopedic condition, a Nexus letter from a physical therapist would be helpful in documenting severity of a condition, which can help in the rating level that you may receive. But it's not going to help you in the actual connection of your condition. Whereas a medical practitioner, like a PA, nurse practitioner, MD or DO, will do is they connect the conditions. They are subject matter experts because they are licensed to treat the condition. They're licensed to diagnose the condition. And so you can use those two different types of documents in support of your orthopedic claim, to where you're supporting the connection with the medical letter, and you're supporting the severity with a physical therapy letter, because the rating for orthopedic conditions, most of them are based on range of motion and physical exam findings, and we cannot do those virtually. So the best people to do those are the ones that are treating you right now, because they're going to be able to really document very detailed how your progression of your condition is going. And so those two combined will be an ideal situation in an orthopedic case. And so similarly, I've seen mental health providers trying to write Nexus letters for sleep apnea. I have a strong opinion about this and disagree with this very, very strongly. because unless they have a specialized training or licensure to treat or examine or evaluate sleep apnea, I don't think that they have the ability or the expertise to write a Nexus letter for that condition. I know some people do, and I know I've seen them, and I know some people would disagree with me. That's just my opinion. I feel that if you're going to write a Nexus letter in support of a veteran's claim, especially if you're going to be charging them funds for that document, you should be a subject matter expert. You should be writing a document you are trained to write, that you are experienced in, or you're licensed in writing. That is just the way that I view things. Because otherwise it's almost it's my opinion, it's no different than asking your mechanic to write a letter. So you wouldn't ask the guy changing your tires or your oil to write you a Nexus letter for sleep apnea. So why would you ask a mental health provider? They're trained in mental health. They are experts in that. Yes. Can they read a medical book? Can they read and understand medical language and write a competent letter? Yes, they can do that. But is it going to be weighted correctly? Is it something that is appropriate? No, I don't believe it is. So that's my little soapbox for that. Another question I get is, I mentioned DO, MD, PA, and nurse practitioners. Are they all considered the same, or is a doctor better to have your Nexus letter written by? According to the VA in the M21-1, this is the rating handbook, the PA, NP, MD, they are all level playing field. They all are considered exactly the same when it comes to medical opinions. They are held with the same level of weight for a medical opinion. So getting a letter from an MD is no different than getting a letter from a PA or a nurse practitioner. The only way a particular provider or grade or standard is if they were a subject matter expert on top of that. For instance, if you were sent for a CMP exam with a pulmonologist or a sleep medicine doctor for your sleep apnea, and your Nexus letter is from us or another general practitioner or your primary care doctor, yes, of course, their opinion may be weighted heavier, but it is rare that the VA does this. Additionally, say your migraine case, you're sent to a neurologist. Of course, their opinion may be held higher than a general practitioner because they are a subject matter expert on top of that. So it doesn't matter if they're an MD, DO, or PA. They could send you to a neurology PA and they would hold a higher weighted standard. It doesn't matter the credentials as much as it matters on the training, licensure, and what you're experiencing. This is also why we include a little bio about ourselves in our Nexus letters, because some of our providers have specialized training, and we want that specialized training to be highlighted and considered in our Nexus letters as subject matter experts. So we like to document that as well. Most CMP exams, the VA will send you to a contract company such as LHI, VES, QTC are the most common ones. And so those companies usually employ general practitioners, nurse practitioners, PAs, doctors, occupational med. I've seen a lot of occ health doctors there, the ones that would do the same type of evaluation if you need a sports physical, if you need a DOT physical, something like that, to where they're doing exams, they're not actually treating patients. They're more specialized in examination and of functional examinations is what a lot of those teams are. So I think it's rare that you're finding CMP examinations with a specialist, but it has happened and I do see it. But there's nothing that we can do or you can do to prevent that. It's kind of the luck of the draw, in my opinion. And so there's no way to prevent that. So I don't necessarily think you need to seek out a specialist for your letter, because most letters are written by general practitioners, and very few, unless they're treating you, are specialists, if at all. This gets me to my last question I was going to answer that I get commonly is, are private Nexus letters better than my treating doctor? Not necessarily. So what is the benefit of getting a Nexus letter by your treating provider? That is, they're familiar with your case. They know all of your conditions very, very deeply because they see you on a regular basis. So they're very familiar with your records. You don't need to provide them any additional records. They have everything they need to evaluate you. But the problem is, if they're not familiar with VA or VA disability, then they may not be familiar with the language that the VA uses, the regulations, precedent cases, how connections are made, which way to actually write the document to where you're communicating your medical opinion appropriately. And so it may or may not benefit you to have a standalone Nexus letter from your treating provider. If they're familiar with the VA and they're comfortable with this and they write a comprehensive letter with all of the correct VA language and communicating the opinion correctly and supporting their opinion with a rationale that actually, that's a huge thing. It's the rationale is very important. It's not just the medical opinion, it's the rationale that of why this opinion is made is very important. So if all of that is met, sure, your primary care doctor, your treating doctor is completely qualified and will provide you an excellent letter. Usually they don't charge for these letters. Sometimes they want to see you and talk to you about it, have an evaluation. I do run into a lot of providers who hear the word VA and run for the hills. They don't want anything to do with it. They don't want to write any documentation, provide anything in support of this, which I think is it's a very sad thing in this country that doctors are afraid to write and support letters for their veteran clients. There's no reason not to, in my opinion. There's no legal reason that your doctor writing their medical opinion about your condition has any kind of negative implications on them, but it's their comfort level. Maybe they're just not comfortable with it, as it's a different animal than they're used to dealing with. But that's where companies like Telemedica come in. We are subject matter experts. We do this day in and day out. We do it for the right reasons. We support the veterans when they need supporting. We tell them we can't help them if it's a document they don't need, or if it's a document that we can't support because there's not enough evidence. We like to hold ourselves to that high standard of you're not getting documents just because you ask for them. I said it many times, not usually so directly. We're not those fast food companies that you get what you want when you ask for it. You don't just roll in and sign up for Telemedica and automatically you're guaranteed a document. That's not how we function at the Nexus team. We evaluate everyone's case. We consider all the evidence that is provided to us, and our medical providers take a look and evaluate between the VA regulation and medical evidence and their training. Does this connection meet the criteria of at least as likely? That is the key. If it meets that criteria of at least as likely, we can support your document. If there's additional questions, we usually ask for additional information or tell you that the case needs additional objective evidence, or we also communicate if we think the case is weak. That doesn't mean that we don't support your case. That means that if we like to look at everything objectively, and we like to say, are there any reasons I could poke a hole in this claim? And if there are reasons, whether it's a gap in care from when you left service to currently, or there are many other reasons, if I could poke holes in this claim, I'm going to call it weak. And it's not to deter you. It's just to communicate this may be an uphill battle. This may be a fight. You may have to file a higher level review or a supplemental claim. You may have to go to your doctor and get additional objective evidence before this claim is awarded. Many reasons why that could be the case, but don't take that as a deterrent. Take that as we are telling you our honest opinion. We are not sugarcoating anything. We are not just writing things to write them. We actually are giving you the best medical advice we can when it comes to our opinion on your connection, on your evidence. And if we see that we can poke holes in it, we look at it from a VA side of why would I deny this case if I worked for the VA? We like to communicate that with you so that you're aware that this has the support it needs. But if it's not successful, you may need to go back to the drawing board and gather additional evidence. That's all it means. So I wanted to make sure I communicated that because I get those questions a lot from clients. Those are the most common questions about a Nexus letter. So what I'm going to do is I'm going to answer a couple of quick other questions that we get. So we get the question of how do I get in touch with Telemedica? And you can reach us many ways. You can get to us through our website. You can get through us through our social media accounts. We have customer service representatives that you can call and get in touch with. What we cannot answer through those avenues is anything specific about your specific connection, because what that requires is a medical professional taking a look at all of your evidence in your specific situation to comment specifically on your connection. So that is one reason that people like to sign up to get that medical evaluation of your conditions that you think are service connected. There's no minimum that the provider will review for. If you have 10 conditions that you think are service connected, we will review 10 conditions. The price is the same. If you have one. We just like to make sure that you communicate that to us on which conditions you feel are service connected, whether it's directly or due to another condition, because we don't hunt for connections. We don't create connections. We don't make them up based on our experience. We like to know what symptoms do you have that you feel may not be due to an organic source that may be related to your service. Let's see here. So I do have some questions. Okay, well, let me start before I answer these questions that are coming in from you guys who are viewing me. Let me answer this one question that I forgot to go over, and it's, what can I do if my Nexus letter is denied? So I started to go into that a little bit towards the end. I threw out some terms: higher level review, supplemental claim, VA Board of Appeals. So a lot of times you have additional options. If you were denied and used a Nexus letter, you have options. So some of those options are gather more evidence. Some of those are higher level review. That's where you ask a supervisor to review the claim. You cannot add any additional information into a higher level review. I recommend doing those in most cases, just because those cases you're allowed to talk to a rater. You're talking to a senior rater. You don't get that option when you're filing your claim initially. Why would you not want to talk to someone who's the decision maker? I think that is hugely valuable to communicate your case, communicate the facts of your case, and how you feel this is connected directly with the decision maker. That, I think, is invaluable to be able to have that option. And I've seen much success with that. The reason that I wouldn't go for it is if they're asking for additional objective information. So if they're saying you just don't have enough medical visits, then a higher level review may not help you in that case. Supplemental claims is where you can provide additional information. One service that Telemedica does offer is a rebuttal service. What that is if you get denied, whether you have a Nexus letter, it may not be your fault. It may not be anything that you've done or what you've submitted. It may just be a misunderstanding with the VA. It may be just not understanding what the VA is communicating to you. A rebuttal letter, if we've written you a Nexus letter, our rebuttal team services can take a look at that denial letter and see if there are ways that we can argue against the denial rationale. If we think the VA got it wrong, if they're misunderstanding your evidence, if the CMP examiner just doesn't understand VA regulation. I've seen that a lot, where they will claim causation. It's the one condition is not caused by another. Causation is not required for service connection. Aggravation can be the cause of your condition. Your service connected condition can aggravate this new condition. So if they're denying you based on causation, and they may be in the wrong. It just may be the CMP examiner is unaware of the circumstances of aggravation. And so a rebuttal letter is an option for us to argue that point on your behalf, to be able to say, hey, for these reasons, here's the denial reason. We break it down as to why we disagree with that rationale and put in our medical opinion again to make sure that it's considered as new evidence. But we were able to explain out in the VA language as to why their rationale doesn't hold up, whether it doesn't hold up to medical evidence by the literature or it doesn't hold up to VA regulation. Those are the two most common reasons. Now, I find a lot of veterans struggle with reading their denial letters. They're not easy. Trust me. You'll get a letter that's 15 pages long. Those letters can be anywhere from 3 pages to 15 pages. They could just say, we denied you because we did, or this huge long reason as to why. And they throw in little bits of regulation that add extra confusion, in my opinion, because you're filing your claim, sleep apnea secondary to PTSD, and you get this denial letter, but it talks about direct connection. You're like, that's not how I filed the claim. They throw in all of these regulations, and it can be confusing to get to the root of the rationale. What you're looking for is the rationale. The C&P examiner provided this rationale, whatever it says. It's usually stated somewhere like that. That's the reason of the denial. And so if you're having any trouble with, if we've provided you a letter and you're having any trouble with the denial, sign up for our rebuttal service and see if we can we'll take a look and see if we can help you. If we can help you with that, that's when we can move forward with it. Now, if you are a new client, someone who did not get a Nexus letter or someone who did not get a Nexus letter from us, can we still help you if your case was denied? Of course. It's not a rebuttal, though. A rebuttal service is only for previous Telemedica clients who we have written your Nexus letter for. You can sign up for a regular Nexus letter service and show us your denial letters, and we will do the same thing. We will dissect and evaluate your denial letter as part of your evidence and include any rebuttal in your document. So if you are new to us and you filed a claim before and you had a denial and the denial rationale didn't make any sense, in addition to the way we normally write our Nexus letters, we're going to comment on that denial rationale, because we're going to want to say this was wrong because of this, and here's the additional support as part of our regular Nexus letter. So those are some options if you've been denied for your claim, whether you're a prior client of ours or you're new to us. So moving on to the couple of questions that I have from viewers here. Let's see, a new and relevant. Let me read this real quick. Okay, so Michael's asking, I'm on a new and relevant on a PTSD, depression, and anxiety. New evidence was from a VA doctor who linked my conditions to at least as likely as not from a personal assault. VA rep was wondering the length of time in VA ratings, meaning myself. It sounds like, Michael, you're talking about primarily a mental health claim. And as a medical provider, I am not an expert in the mental health claims as far as what their specific requirements are and their specific ratings are. Our mental health team definitely is more well-versed in a lot of those. And so I think I would defer any questions to our mental health team for anything related to that condition. So second question is, if a PA with our company says they cannot supply Nexus at the moment, do they speak for the whole company? And is there a chance that another provider will indeed write the Nexus letter? That's a good question. I'm glad you asked that question, Tom, because we have a process for that. So I am the lead Nexus provider. And so we have several other medical providers, and each medical provider has their own medical opinion. Now, I do train all of the providers, but that doesn't mean that they don't have different medical opinions. And so what we like to do in this situation is we like you to submit a ticket on Telemedica's website. And what that does is that ticket will go to me for review, and I will review the entire case. I'll review the uploaded documents. I'll review the communication between you and the medical provider. And sometimes I even talk to the medical provider and find out what's their rationale for not being able to provide you a Nexus. And at that point, we evaluate, is this an error? Is this a medical opinion that might differ? And do we have a specialist on staff that may be better suited for your specific claim? Or if this is something that we cannot provide right now for X, Y, and Z reasons. And so if we cannot provide it right now, usually it means there's not enough objective evidence in some way, shape, or form. And we like our providers to communicate exactly what they're missing or what they're seeing as not being able to provide that connection. The most common reason I can think of to where when we cannot provide a Nexus for someone is that there's not a clear differentiation with that medical condition. So say you're service connected for something and they may have symptoms that overlap. We need to determine that there is a clear medical condition separate from your service connected condition so that that symptom is not rated twice. That's called pyramiding. Your symptom cannot be rated twice. So we need to make sure that, for instance, if you have headaches related to something that your mental health condition isn't documented as having headaches associated with it, you're not rated for headaches as part of your service connected condition. That's one reason. Another reason that we can't do a Nexus letter right now, a lot of times, is if there's not a clear diagnosis. If there's still additional testing that needs to be done, that's a huge one. If, say, you were diagnosed with a headache condition, or sleep apnea is a good one, sleep apnea, but they documented that you have a lot of features of potentially, instead of obstructive sleep apnea, central sleep apnea, we need to have an evaluation that central sleep apnea is ruled out in order to write you an obstructive sleep apnea note. Some providers will randomly write obstructive sleep apnea by mistake and not realize there are other forms of apnea, that obstructive is not the only one. And so if things like that, or if your doctor documents, I need to get lab work, I need to get CAT scan, I need to see a specialist in order to rule out other conditions that may be causing your symptoms, those are the most common reasons why we can't do a document at the moment, and we defer to getting additional information. So if you would like to fill out a ticket on Telemedica's website, that's going to get routed to me for review, and I can review the whole case and provide you more specific details as to why the provider may or may not have been able to write that letter. And if there is an error, I also evaluate for those as well to see if there's a potential error in their evaluation. Let's see, we have a few more questions. I have one from Chris who's saying, waiting for the Nexus letter, should get it next week. Can I read and see if it needs to be made stronger? Can I talk with a Telemedica on their opinion? Okay. Telemedica Nexus letter provider thinks the guard. Okay. So yes, once we're done with our Nexus letters, the process is we submit it to you, and we ask you to review it. We want you to review your Nexus letter for any errors or anything we might have gotten wrong. Now, this usually comprises of clerical errors, technical errors, things like that. In your question of, can I see if it needs to be made stronger? That depends on what your concern is about the Nexus letter that they provide for you. I've had a few veterans try to rewrite their Nexus letters and ask the provider to sign it. That's not appropriate. The Nexus letter that it's a medical opinion by that provider. They are licensed and credentialed and use their licensure for that document. And so it's not something they're going to put their signature on your work. Now, that doesn't mean that they are not going to evaluate your concerns and your requests. We do that through the ticket system as well. And so depending on what you mean by needs to be made stronger, that specific phrase is something that that we need to know specifics on in order to be able to answer that. But yes, we do want you to read the letter. We do want you to, if you have questions, concerns, or any requests, we do want you to fill out a ticket so that the provider can take a look at that and consider what you're asking. You also wrote, might not approve based off of their experience. This is why our Nexus letters are not based on our experience. Yes, our experience can enhance your Nexus letter. However, it's not based on our experience alone. That's why we use medical-based evidence to support our opinions. We don't want our letters to rest solely on the provider or their experience, because our providers are trained to treat any condition. They're general practice medical providers. Some of them have specialty training, specialty experience. Like I mentioned, such as myself, I have emergency medicine experience, so critical care experience. I also have surgical experience. And so I've worked in all specialties. I specialized in cardiac and ENT, women's health. So I do have specialized training in those areas. So each of our providers have specialized training above and beyond the general practice licensure, but they are able to write letters for any medical condition. And this is why, like I said, we support our letters with medical-based evidence, because it's not about our experience. That's not what a service connection or a Nexus letter should be based on. Okay. If there's any other questions, I'd be more than happy to answer them. If I don't get to any questions and you think of something after this, or viewing it after the live and you think of something, don't hesitate to reach out and ask. Type it in the comments of there. We're able to take a look and possibly respond back to questions you may think of later, or don't hesitate to reach out to us. We'd be more than happy to try to answer all of your questions. But otherwise, we will be seeing you next week to talk about another topic in the support evidence month that we're going to be talking about evidence to support your VA disability claims. So check us out next week, next Wednesday, same time, in order to hear a little bit more about another evidence topic. All right, take care and have a great day.